Hi, this is the health assessment video for MSN 572. I will be starting this video by getting consent from the patient. Do you give me consent to record this video and upload it as unlisted for my instructor to view and grade?
Yes, I do.
Awesome. Hi, my name is Renika and I will be taking care of you today. I have washed my hands. I have understood that you are here for a visit today?
Yes, that is correct.
Awesome. Can you please tell me your full name?
Yes, my name is Gina Choi.
Awesome. And how would you like to be addressed?
Yeah, Gina is fine.
Awesome, Gina. If you could please tell me what gender you identify as.
Female.
Female, perfect. And Gina, if you could please tell me your date of birth.
9/15/83.
Awesome. Can you tell me how old that makes you, Gina?
Yes, 39 years old.
39, awesome. You look great for
Oh,
39.
thank you.
I was just wondering, Gina, how did you get here today?
I drove.
Awesome. And did you come by yourself? Did you have someone come with you?
Yes, I came by myself.
By yourself, perfect. And then if you just want to go ahead and tell me your race.
Yes, I'm Asian.
Asian, awesome. And what about your ethnicity, Gina?
I am Korean.
Korean, awesome. And then are you married?
I am single.
Single, awesome. And what is your occupation?
I am a teacher.
A teacher. Awesome, perfect. That's amazing.
Yeah.
And then do you live around here, Gina? If you don't mind, if we can have your address?
Yes, I live in Dublin, and that's at 5200 Iron Horse Parkway.
Awesome, perfect. And then, so I just wanted to ask you, Gina, what brings you in today?
For a wellness check.
A wellness check,
Yeah.
perfect. And if you could go ahead and tell me when your last wellness exam was.
It was a year ago.
A year ago, perfect. You're really on top of it. Get that yearly
I
check.
tried.
Awesome. And then at your wellness exam a year ago, did you have any tests that were conducted?
Yes, I got my labs done. And yeah, that's it.
Do you remember which labs were done? Any specific ones or just kind of routine?
Yeah, routine labs. I believe it was like checking my cholesterol, and then my red blood cells, white blood cells, all of that.
Awesome. And do you happen to remember what the results were of those lab tests?
Yes, everything was fine.
Everything
Yes.
was normal. Good. We love to hear that. And then did they do any screenings at all at that last wellness exam?
No.
No screenings.
No screenings.
Awesome. Any recent immunizations or any immunizations that were done at that visit?
No, not at that visit, but I am up to date with all my immunizations.
Awesome. Did you get your COVID vaccine?
Yes, I did.
And what about the booster?
Yes, I did.
So you're awesome. Do you happen to remember when you got your vaccine and the booster?
Yes, in August of 2021,
Awesome.
and then the booster about 3 months ago.
Perfect. And what about the flu shot, Gina? Have you had your yearly flu shot?
I have not gotten the flu shot.
No
yet.
flu shot yet. Okay, no worries. It is flu season, so
Yes.
just a friendly reminder that we recommend everyone to get the flu shot. Awesome. And then, Gina, do you remember when your last dental visit was?
Yes, it was about a month ago.
A month ago. Perfect. And what about your last eye exam? I see you do wear glasses.
Yes, that was last month.
Last month as well. And how long have you been wearing glasses for?
I actually normally wear contacts and just recently wear glasses.
Okay,
So I try
awesome.
to give my eyes a break from the contacts. So.
Good to know. So how long have you been wearing contacts or glasses?
I would say about 20 years now.
20 years, wow. Any so at your last eye exam, were there any significant changes to your vision?
No, everything was the same.
Awesome, good to hear. And when was your last pap smear?
Last pap smear was a year ago.
Perfect. And how were the results of that pap smear?
Yes, everything was negative.
Everything
Looked good.
perfect. So I'm just going to go into delve a little bit more into your past kind of medical history. So I'm just going to ask a little bit of questions about that. Did you have any childhood illnesses? Anything like measles, rubella, mumps, whooping cough, chickenpox, rheumatic fever, scarlet fever, or polio?
No, none of those.
None of those. Okay, awesome. And then, are you up to date on your childhood immunizations?
Yes, I am.
Perfect.
Uh-huh.
And then, do you have any current illnesses or diagnoses?
No, I don't.
No illnesses or diagnosis, no worries. Any medical problems that we should be aware of?
I would just nothing. I would just say back pain.
Back pain?
Yeah.
No worries. I'm gonna add that on here. And Gina, when did your back pain begin?
It was about 5 years ago.
5 years ago. And how often does your back pain occur? Is it something that's constant or more intermittent?
Right now it's just aggravated by like certain activities.
Yeah.
But currently it's okay.
Do you mind telling me what activities aggravate that back pain?
I would say if I lift heavy objects, then
Okay.
I'll feel it more. So I try to use proper body mechanics as much as possible.
Awesome.
And sometimes if I sit too long, I'll get numbness
Okay.
in the leg.
And then if you could tell me how often you think the pain is occurring?
I would say maybe like twice a week.
Okay, twice a week. And then on a scale of 0 to 10, how would you rate the pain?
You mean currently or
Just when it occurs.
when it occurs?
Yeah.
Like a 2 to 3.
Okay, so
It's
manageable. Awesome. And then can you describe what the pain is? Is it kind of like a throbbing feeling, a
Mhm.
sharp pain? Is it dull? Does it radiate
Yeah.
to your leg or anything like that?
It's more like just a dull pain.
Dull pain.
But again, if I sit too long, I'll start to feel it down my leg a little bit.
Okay.
Yeah.
Let me write that down. And then do you take anything to help with the pain, Gina? Any prescribed medications or over-the-counter medications to help with the pain?
Yeah, I take turmeric sometimes to help
Turmeric?
with the inflammation. Is
Okay.
what I heard it's good for. But if it gets kind of severe, I'll take an Advil
Awesome.
or
And then
Tylenol.
Tylenol, perfect. So for the turmeric,
Yeah.
does it help when you take it? Do you take capsules?
I take capsules. I take 3 capsules in the morning, yeah.
In the morning,
Mhm.
okay. And what about the Advil? How often would you take that? And usually,
Yeah, if
Does
it's
it
like
help?
pretty bad, like I aggravated it, I would say maybe every 6 hours.
and do you know the dosage that you take of the Advil?
I think it's 200 milligrams. If it gets bad, I might take 2 of those or maybe 600 milligrams.
Okay, and does that tend to help?
It does. It definitely relieves
Awesome.
it.
And then lastly, what about the Tylenol? How often would you take that for the pain?
I would just say probably once, like
Okay.
if it hurts, once a day.
Yeah. And do you know the dosage of the Tylenol?
I believe I take the extra strength one, which is 650
Okay, yeah.
milligrams, I think.
Uh-huh. Awesome. And does that tend to help?
Yes, definitely.
Perfect. And then are you using any like alternative therapies to help relieve the pain? Like for example, stretches or yoga, anything
Yes,
like that?
I do. I do a lot of stretching, and that really
Awesome.
helps relieve the pain. I try to do yoga as well.
Okay.
I feel like that's been helping.
Okay, perfect. Awesome. And then any psychiatric diagnosis such as anxiety or depression?
Nope. Yeah,
Awesome. Any hospitalizations in the past that occurred?
No, none.
Perfect. Any history of surgeries that you've gone through?
No.
No surgeries. Perfect. And then are you using any prescription medications at this time?
No, currently I'm not.
What about any over-the-counter medications?
Any over the counter?
Besides the one that you mentioned earlier for the
Yes.
back pain?
No, none.
Nothing.
Mhm.
Are you taking any herbal medications?
Herbal medications. I do take supplements.
Supplements?
Uh,
Yeah, so any vitamins as well? Do
yeah,
you take anything
I
like
take
that?
vitamin D.
Vitamin D,
and
awesome.
Vitamin B12.
Do you happen to know the dosages of those?
I think for the vitamin B12, it's 2,500 micrograms.
Okay. And then for both of them, how often do you take them?
Once a day.
Once a day in the morning or
In the morning.
in the morning?
Yes.
Awesome. We note that down.
Mhm.
Perfect. So we're just gonna move on to your allergies. Do you have any Environmental allergies, Gina?
None.
What about any allergies to food or any sensitivities?
I would say dairy.
Dairy,
Yeah.
no worries. And then do you take anything to help with the dairy intolerance?
I take Lactaid.
Lactate.
Yeah.
And does that seem to help?
It does, yes.
Perfect. How many pills of Lactate do you usually take every time you eat dairy?
Just one.
Just one.
Before, yeah.
One before, awesome. And then any allergies to medications?
Not that I know of.
Not that you know of. Awesome. And I just wanted to know, Gina, when was your last mammogram, if you have had any?
Mammogram, I have not. No.
Never had a mammogram, no worries. And then also, if you could tell me the last time you had your pap smear.
Pap smear was a little over a year ago.
A little over a year ago, perfect. And then I just wanted to ask about your sleep, Gina. How many hours do you, on average, sleep a night?
I would say between 6 to 8
It's between 6 to 8.
hours.
And then when you wake up, do you feel rested?
Not always.
Not always.
Yeah.
Okay. Do you take anything to help you sleep?
Yeah, sometimes I'll take a melatonin.
Do you know what dosage of melatonin you usually take?
I believe it's 3 milligrams.
And how often do you take your melatonin, Gina?
Maybe like twice a week.
Twice a week. No worries. And do you think, do you see that it helps you?
I would say it does, yes. But I
Awesome.
try not to take it every day and like depend on it.
Yeah.
So I'm just taking it like twice a week.
Okay.
I really need it.
Totally makes sense. And then tell me a little bit about your eating habits. Do you order out a lot or do you cook more at home?
I would say it's pretty split,
Okay.
50-50.
Yeah. If you want to tell me kind of like the past 24 hours, how your meal intake kind of was like.
Sure. Well, let's see. In the morning, I had oatmeal with fruits.
Awesome.
And then for lunch, I did takeout. And then I had a sandwich. And then for dinner, I cooked pasta.
Awesome. I'm gonna add that. Sounds delicious. Just a quick question: do you tend to add more salt or anything to your meals? Just want to kind of gauge your salt intake.
Yes. I know too much salt isn't good for you. I do like to, add more salt to my food though.
Okay.
Just tastes better.
Totally get it. And then if you want to tell me about your caffeine intake, how many cups of coffee, tea, energy drinks, anything like that do you consume approximately in one day?
I would say I have a cup of coffee every morning, and then I'll also have like a green tea.
Okay.
During the day.
And then is that green tea caffeinated?
Yes.
Okay. Awesome. Let me write that down. And then I just wanted to ask about your exercise. How many times would you say you exercise within a week?
I would say maybe about 2 to 3.
2 to 3 times a week?
Yeah.
Awesome. And then usually how long would those exercise sessions last for?
I would say 2 hours.
2 hours each. Okay. Awesome.
Sorry,
All right.
1 to 2 hours.
1 to 2 hours, no worries. We'll change that. And then I just wanted to ask, how much tobacco do you consume per day via smoking?
No.
None.
Yeah, I don't smoke. Yeah.
No smoking. Awesome. And then how much tobacco do you chew a day?
None.
None. Awesome. And then, Gina, how many alcoholic drinks do you consume per week?
Per week? I would say like maybe once in a month.
Once in a month. Okay. And then have you ever tried any illicit drugs, Gina?
No.
No. Perfect. So we're going to move on to the family history. I just want a little bit more information on your immediate family, just to gather some history.
Okay.
So if you could provide the health history of your maternal grandfather.
Yes, he had hypertension.
Okay.
And
is he still with us today?
no, he's deceased.
And would you happen to know at what age he passed away?
72.
72. I'm so sorry to hear that.
Thank you.
Would you happen to remember how he passed away?
Cancer.
Cancer. Let me write that down. And then Gina, if you could provide the health history for your maternal grandmother.
I think she was fairly healthy.
Fairly healthy.
Yeah.
Let me just quickly, for your maternal grandfather, what type of cancer?
Maternal grand.
No, it's okay. I'm backtracking.
Oh, okay.
What type of cancer did he pass away from? I just wanted to add that to my notes really quickly.
That's from maternal.
Grandfather, the one you just mentioned with the pass away from.
Maternal grandfather. Actually, sorry, I thought it was paternal.
Oh, no worries.
Maternal grandfather. He just passed away from old age. He was
Passed away
very
from old
healthy.
age. Okay.
Yeah.
Let me fix that on my
Sorry
notes.
about that.
No, it's okay. It gets a little confusing, the maternal and paternal. I totally get it. Perfect. I just wanted to make sure I had that. And then you said your maternal grandmother was fairly healthy. Is she?
Oh, yeah. So maternal grandmother, she had, believe, high blood pressure.
Okay.
And high cholesterol.
And is she still with us?
No, she's deceased.
And if you could let me know how she passed away.
Just old age.
Old age.
Yeah.
And do you remember what age she was when she passed away?
I don't remember exactly. Maybe like 70.
Around 70. Okay. I'm so sorry to hear that. And we're just gonna keep going. If you could provide the health history for your paternal grandfather.
Paternal, yes. He had high blood pressure.
Awesome. Anything else?
Not that I know of.
Perfect.
I was young when he passed away.
Okay.
And he passed away from cancer.
And what type of cancer did he pass away from, Gina?
I think it's bone.
Bone cancer? Oh no. Do you happen to know how old he was when he passed away?
70. I think I'm confusing. I'm so sorry.
No, it's okay.
He's 70. He was 72. My maternal grandfather passed away at like 102.
Oh wow.
Yeah.
Okay.
Sorry, confused.
No, it's okay. The maternal paternal can be very confusing. I totally get it. So can you provide the health history for your paternal grandmother, which is your dad's mom?
Right.
Mm-hmm.
Okay. For dad's, she's still alive.
Okay. Awesome.
Yep. And she has diabetes.
Okay.
And that's it.
Awesome.
Yeah.
Let me write that down. Perfect. And then if you could provide the health history for your mother.
Yes. For mother, she had high cholesterol.
Anything else?
And she is deceased.
She's deceased. And do you remember how old she was when she passed away?
I want to say 56.
56. And what was the cause of her death, Gina?
Cancer.
Cancer. What type of cancer?
Colon cancer.
Colon cancer. So sorry to hear that.
Thank you.
Must have been rough.
Yeah.
And then can you provide the health history for your father?
Yes. Father, he had high blood pressure.
Yeah, no worries.
And like borderline diabetic.
Okay, borderline. Like pre-diabetic? would you say?
Yeah.
Okay. Perfect. And then is he still with us?
No.
And do you know, could you tell me the cause of death for your
Yes,
father?
a heart attack.
Heart attack. And how old was he when he passed away?
58.
58. And Gina, are you able to provide the health history for your aunts?
I'm not too.
Yeah, no worries,
familiar,
no worries. What about the health history for your uncles?
Yeah, same there.
No worries. Do you have any siblings, Gina?
I do. I have 2.
And how old are your siblings?
They are. My sister is 31.
Okay.
And my brother is 28.
Sister 31 and your brother's 20 is perfect. Do you know any health problems that your siblings may have? Oh, no worries.
I'm sorry. Can you?
One more time. No worries. Do you know any health problems that your siblings have?
None.
None.
They're
No
healthy,
problems.
Yeah.
Okay, perfect. And then do you have any children, Gina?
I do not have any children.
Awesome. Earlier you mentioned that you were a teacher. Where do you teach, if you don't mind me asking?
Yes, in Dublin.
Dublin.
Yeah,
And
close by.
what do you teach?
Music.
Music.
Yeah.
Awesome. Do you enjoy your job?
I love it. Yes. Yeah.
Are there any stressors from your job that you may have?
Not in particular.
Okay.
I would say. Yeah.
It's pretty enjoyable.
Yeah, I love music, so.
Perfect. I know you mentioned earlier that you are not married, but are you in a relationship or are you currently single?
Yes, I'm currently in a relationship.
In a relationship, perfect. And are you sexually active?
Yes.
Perfect. Do you use any form of birth control?
No.
No birth control, no worries. And if you don't mind telling me your sexual orientation, Gina?
Straight.
Straight. And do you have multiple partners?
No, just one.
Perfect. And when was the last time that you got tested for a STI?
Yes, that was also with the pap smear 1
1 year ago?
Yeah.
Okay, no worries. And then, Gina, have you ever been pregnant before?
I've never been pregnant.
Never pregnant. And when was your last menstrual cycle?
2 weeks ago.
2 weeks ago?
Yep.
And then do you have regular periods?
Yeah, they're pretty consistent.
Pretty consistent.
Yeah.
How would you describe the flow of your period?
It's actually fairly light.
Fairly light.
I do notice that if I'm stressed out, then I might, I'm not routine, so then I might have it like a week later or two. A week or two later.
Okay. No worries.
It's not always consistent.
Got it. And then do you have any history of painful periods?
No, I don't. Yeah.
Awesome. And any history of ovarian cysts?
No history of that.
All right. Gina, if you could tell me your education level.
Yes. I have a bachelor's.
Awesome. And then do you live by yourself? Do you live with family, your partner?
Yes, I live alone.
Live alone. And do you live in a house or an apartment?
I live in an apartment.
Perfect. Do you follow any religion, Gina?
I am Christian.
Christian. Are you religious? Do you think religion has a big impact on your life?
Yeah, I feel like it's helped me cope with stress.
Okay. Great. I can follow up with how do you handle stressful situations?
How do I handle stressful? I would say, listening to like just relaxing music.
Yeah.
Maybe taking a nice bath.
I love that.
Just meditating. And exercising helps too.
Yeah. Awesome. I love that. So we're going to go ahead and just move into I'm going to ask some questions on your system. So we're just kind of go through the body and ask a couple of questions. If you could just answer to the best of your ability, okay?
Sure.
So have you had any fevers?
No.
Have you had any chills?
No.
Any night sweats?
No.
Any weight loss?
No.
Any recent weight gain?
No.
Any recent change in appetite?
No.
Have you noticed that you're tired more lately? Any fatigue?
No. I just think I need to be better with my sleep.
With your sleep? Yeah, no worries. Have you noticed any vision loss or blurred vision?
No.
Any double vision?
Nope.
Any pain in the eye?
No pain.
No pain. Awesome. Any ear pain?
No, I don't have ear pain.
Did you have any discharge from the ear?
No.
Have you noticed any hearing loss?
Nope.
How about ringing in the ear?
No.
Awesome. And then have you noticed any nosebleeds or nasal discharge?
No.
Any pressure in your sinuses?
Nope.
Any recent sore throat?
Nope.
Any recent oral sores or lesions?
No.
Any tooth pain?
No.
Any recent bleeding gum?
No.
Have you noticed that your voice is a little hoarser recently?
No.
Any neck pain?
No neck pain.
Have you noticed maybe any like swollen areas or lumps or bumps in the neck area?
No.
No. Okay, awesome. Have you noticed any chest pain?
No chest pain.
Any recent palpitations or
No.
tightness in the chest?
No.
Any have you checked your blood pressure recently?
Maybe about 2 months ago.
Do you happen to remember what your blood pressure was like 2 months
It was
ago?
like 101/74.
Okay. And then any history of like high cholesterol?
No.
Have you noticed any swelling in your legs?
No swelling.
And how about pain on your legs while you're walking?
No.
No, awesome, perfect. We're gonna go ahead and move to the respiratory section. So have you noticed a cough recently?
No cough.
or a productive cough where you're coughing out some phlegm, anything like that?
No.
Any blood from the lungs, or like coughing out blood or
No.
anything like that? Awesome. Any wheezing?
No.
And then any snoring, Gina?
No.
Awesome. And then how about, have you felt any shortness of breath?
No.
What about shortness of breath with activity?
No.
How about when you're lying down?
No.
Awesome. And then have you ever woken up from being asleep because you have some shortness of breath?
No.
All right. And then any recent nausea or vomiting?
No.
Any diarrhea?
No.
Any constipation?
No.
Any history of abdominal pain?
No.
Any bright red stools?
No.
Any black tarry stools?
No.
Have you had any issues with going to the bathroom?
No.
Awesome. Any pain while you're urinating?
No.
Awesome. Any like urgency to go to the bathroom?
None.
Has the amount of times you go to the bathroom increased, the frequency?
No.
Awesome. And then do you have to wake up in the middle of the night to use the restroom?
Generally, no.
Okay,
Yeah.
perfect. And then do you have any bone pain?
Bone pain? No.
How about some joint pain or joint swelling? So it may be like stiff joints, or you're not able to complete the kind of like a range of motion.
Yeah, no problems with that.
Okay, and how about some muscle pain?
Just aside from nothing
back
aside
pain.
from the back pain
So
that I occasionally get.
Yeah, no worries. And then any lumps in your breast?
No.
Any history of pain in your breast?
None.
Any leakage from the breast?
No.
No worries. Have you noticed any hair or nail changes?
No.
Any skin rashes such as like eczema or psoriasis?
No.
Awesome. And then any history of like headaches?
No.
How about muscle weakness?
No.
Have you noticed anything, any sensation changes such as numbness, coldness, crawling or prickling feelings?
None.
Okay, perfect. Have you had any memory loss?
None.
Any seizures recently?
Nope.
Any recent dizziness?
Dizziness? No.
Any recent lightheadedness?
No.
How about some recent vertigo, which is when kind of this room spins around?
No, I haven't had that.
Awesome. Any fainting or imbalance recently?
No.
Awesome. And then any history of anxiety, Gina?
No.
How about feeling of sadness?
No.
Feelings of hopelessness?
No.
Have you had any suicidal thoughts recently?
None.
Have you had insomnia or a history of insomnia?
No.
Any recent mood changes?
No.
Perfect. Any heat intolerance or cold intolerance?
No.
Any increase in excessive thirst?
No.
How about increase in excessive hunger?
No.
Awesome. Have you noticed any lymph nodes enlargement? So our lymph nodes can be found in our neck, our underarms, in our hip area. Have you noticed any lumps or swelling in those areas?
I have not.
Awesome. And then are you bleeding or bruising much easier than before, or
No.
just normal?
Yeah, just the normal.
Perfect. And then do you have a history of hives
None.
and any HIV exposure recently?
No. None.
Awesome. So that concludes our assessment today, Gina. Thank you so much for letting me assess you.
Yes, thank
Thank
you.
you.